All right, welcome everyone. Thank you for tuning into our Spotlight series for the best in Utah pelvic health. I have Dr. Christine Hashman. Did I say that right?
Um,
Hashem,
Hachem,
Hashem,
no worries.
Hashem.
I'll take it all.
I tried really hard. I even practiced beforehand, guys. And we're so thankful that she's here with us to share her expertise in gastroenterology. And before we get started, I'm going to read her bio just so everyone knows who she is, what she's about, and we'll jump into all the questions that we have. So thank you so much for being on with us.
Thank you.
All right. Dr. Christine graduated summa cum laude from Rice University in biology and earned her medical degree with honors from Baylor College of Medicine. She completed her internal medicine training at Washington University and a gastroenterology fellowship at St. Louis University, where she later became a professor of medicine. An active member of the American College of Gastroenterology, Dr. Hashem was elected Missouri governor for the organization and has been considered consistently recognized as a top gastroenterologist. Board certified in gastroenterology. I'm having to get all these words out of my mouth here. She specializes in esophageal disease, motility disorders, and cystic fibrosis. She has extensive research experience in numerous publications. Now based in Utah, which we're so thankful to have you here.
Yep.
She enjoys exploring the outdoors with her family, including her two children and their dog. She is dedicated to the community service and mentoring the next generation of medical professions. I love that. Thank you so much for all that you do already.
Thank you so much. Thanks for having me.
Absolutely. Okay, we'll jump into those questions without further ado and kind of walk us through like what made you decide to be in gastroenterology and what got you down this path?
Well, first of all, I love to eat. And so I don't like for anybody to have any disturbances with being able to eat, right? So whether they can't swallow, they can't go to the bathroom, they have belly pain, I feel like that's my mission is to help people enjoy life. So
I love
that is kind of the main reason. But GI is fascinating. If you listen to someone and they tell you their story, you can really get so much about what's going on in them physiologically just by listening to them.
that.
GI also has the ability to really have you can take care of acute emergencies, but you can also have really great relationships with your patients. So it's a good mix for me.
I love that. That's so awesome. Very similar um, feel and clinical ethos that we have here at Reborn too. So, okay, walk us through what makes you different from one GI doc to the next GI doc to the next. Like, what's different and special about you, the way you treat the patients you see, the procedures you do? Talk us through that.
I had a really great mentor when I was training who really taught me the importance of listening to the patient and being empathic. And so I feel like that colors a lot of how I teach and how I practice medicine. Also, I have been in academics for about 20 years, so I have that perspective. Not a lot of people have transitioned to community practice, but also have had that experience of really training and teaching future gastroenterologists, probably as well as other physicians and specialties. So I think that really gives me a different vantage point when I see my patients.
Totally, totally. Love that. Okay. Talk to us about who's an ideal fit for you. Obviously, everyone eats, but like who are your favorite patients to treat? What are the ones that you're like, "Oh, I can't wait to help them feel better." And so walk us through who's your ideal patient and clientele? Who should come see you?
I mean, that's a trick question because I feel like everyone is an ideal
Yeah.
patient, right? I think anyone that wants help and that is looking for an answer, even if the answer is we don't know, I think sometimes they need to hear that, right?
Mhm.
There's still a lot that medicine is developing and learning, and I will learn with the patient. I think an ideal patient is someone that wants someone to listen to them and has experience in treating complicated cases. So I think I'm used to also patients that have seen other physicians who are still looking for answers, as well as those patients that haven't seen a gastroenterologist. So I think really I'll take anybody. I think it's a gift to be able to help patients. So
Love
if
that.
they're looking for help, I think they're an ideal patient for me.
Amazing, amazing. Okay. To walk us through what the process to work with you looks like. Is it obviously you need an appointment and do you need a referral? Do they just schedule on you? How far booked out are you? And then what does that initial consultation look like and what can they expect when they come in?
Sure. It varies in terms of how far we're booked out, but we can always get patients in if there's some urgency to it. So I think being your best advocate to get yourself in, or you're speaking to your referring physician. Usually, as a specialist, we do require a referral, or insurances require a referral. I don't require anything, so
Yeah,
it's
yeah.
really insurance dependent.
Mhm.
We actually see patients who have no insurance to patients who have private or Medicare or Medicaid. So we see all patients. But I think insurance usually requires referral. I see patients. We have a team in our clinic, so we have advanced practice providers that see patients as well. But if there's a specific request from me, you certainly can see me in the clinic. Like I said, I think the important part is listening to the patient and their story and their goals, right? To help to achieve those goals for them. And depending on that, I can decide if there's more testing that's needed. Not always do patients need more testing, right? A lot of times when they've seen me, they've already had 8 million tests. So sometimes it's not more tests.
Right.
And hopefully it's more answers and an opportunity to help them feel better.
Yeah. Can you talk about what types of procedures you do and what types of imaging or anything that you would order for them? Like if someone's like, "Oh, I know I need to get this," and they'd be like, "Oh, this is the person that would be able to help me with that."
Sure. I think one of the specialized tests that we do provide that not a lot of the community does is the anorectal manometry. So that really helps us further define what's causing patients problems with constipation. So obviously we can do testing to figure out uh, why someone's having constipation, whether it's slow transit or pelvic floor outlet obstruction. But I think that test that we offer in clinic is really a special test that not everyone has. And it really helps our physical therapists,
Yes.
partners, in terms of helping define what is going on when they're trying to have a bowel movement, as well as for treatment. So I think that's a great test that we have available.
Amazing. Thank you. And then what is something that most people don't know, but that you think that they should know about your practice, your profession, what you can do to help people with?
I think people think that the physician has all the answers, but I think it's really a team approach, right? So, and I think from my front desk to my medical assistant to our amazing nurses that do the anorectal manometry procedure to the physical therapists that we work with, I love medicine and I love GI because it really is a team approach. I
Yes.
don't know if everyone knows that. I think they come to the doctor asking for an answer, and I think the doctor is going to provide the answer. But sometimes it's the physical therapist that provides the treatment and the answer, actually.
Yeah, totally. I agree 100%. It's very collaborative, being able to cross over, know who specializes in what and work together collaborative so the patient wins.
Yes, absolutely. I agree.
Yeah. Kate, is there anything special that you want to promote? Is there any upcoming events or seminars or workshops or something regarding health that you're like just want to promote of like food is good or like, it could be simple like that.
Well,
Whatever you
obviously,
would like to, this is your platform to say whatever you want right now.
March is Colon Cancer Screening Awareness Month, so I will
Okay,
promote colon cancer screening
wonderful.
however you want to do it.
Wonderful.
Um, but at this time, we're still growing our anal rectal manometry program and our pelvic floor program, working with our partners such as your group. So I think keep staying in touch with us, and there will be more to come.
Awesome. So great. Wonderful. Okay. And then this is my favorite question that I ask everyone on the Spotlight series is what is the main thing that you want to be known for?
Wow, I think that's a tough question. I want to be known for being compassionate physician. You know, I think that and being able to have a connection with my patients is really important to me as a
Yeah.
people person.
Yes. Same. Speaking from the same heart here. Love it. Kate, thank you so much for being on our Spotlight series. Thank you for
Absolutely.
everything that you're doing for our community. Thank you for your partnership with patients. It's just been a pleasure to have you on our Spotlight series, and we think very highly of you and love having you in our back pocket for patient care. So thank you so much.
Thank you too. So you guys have been amazing partners as well.